So this week, I am honored to introduce Dr. Felicia Connor. She is going to be talking to us about tackling head injuries and concussions and her life as a neuropsychologist. Next week, we're going to be talking to Dr. Nicholas Conti about his dental degree. So Felicia, I'm going to look over here. Felicia is a licensed clinical psychologist who practices in Delaware and New York. She holds board certification in rehabilitation psychology. She is the co-founder of NFN Brain Connections in Dover, Delaware, and the director of training at NYU Langone Health Risk Rehabilitation for an APA accredited predoctoral training program where she specializes in training doctoral level students in rehab with individuals dealing with neurological and medical conditions. Her diverse career spans across working with children, adolescents, and adults, and offering psychotherapy to individuals, families, and groups. Over the past decade, she has honed her expertise in neuropsychological assessment and rehabilitation to include cognitive coaching, focusing on individuals grappling with medical and neurological conditions such as concussion, brain injury, and multiple sclerosis. Dr. Connor has pursued her undergraduate studies at Johnson C. Smith University, earned her doctorate in clinical psychology from Argosy University. She completed her internship and postdoctoral year at Holcomb Behavioral Health. She held a psychologist position in the rehab department at AI DuPont Children's Hospital and served as a senior level psychologist at NYU Langone Health. Outside of her professional pursuits, she enjoys traveling, reading, attending art museums, and spending time with her family on the soccer field. So, Dr. Connor, I'm going to turn it over to you to introduce our other guest.
Thank you so much. Thanks for joining us tonight. So we also have Dr. Natashia Brown. She is the co-founder of NFN Brain Connections, again, that's located here. She's also a neuropsychologist within a private practice in Brooklyn, New York. And she has, for the last, 10 to 15 years, worked with various neurological conditions from autism spectrum disorders, stroke, traumatic brain injury, epilepsy, and other neurological conditions. She's been trained and specializes in neuropsychological assessment. And she is really happy to be sharing this presentation with me this evening. I did not have to pull her leg too hard. So I'm happy that she's here. And I will share my screen so that we can get started. So this evening, we will be presenting on the topic tackling head injuries and concussions, the diverse life of a neuropsychologist, presented by myself and Dr. Natashia Brown. We have no disclosures to give. So when we think about what a psychologist is, a psychologist is someone who's trained in the area of human thought, emotions, and behavior. They serve many different roles as clinicians, that you may see in a hospital setting, a researcher that you may see in the Department of Defense or the government, a professor in an academic setting, in the school environment. A school psychologist is usually what people recognize, and then also a consultant. A psychologist can consult in many different areas. It's important to note that most neuropsychologists are trained first as a clinical or a counseling psychologist before they can become a neuropsychologist. So there are many steps to getting to where Dr. Brown and I are. But one of the first steps is, after receiving your high school, diploma, You go on to college, where you will get a 4-year, usually a 3 or 4 year bachelor degree in a related field. It could be clinical psychology. The next step is going on to graduate school. There are a couple different paths within graduate school. Some folks go on to get a master's degree, which is a 2-year degree. So it's 2 years in graduate school. But then folks go on to get a doctoral degree, which is another 3 to 5 years, depending on your journey. Once you've graduated, as you're, working to graduate from graduate school, you will end up doing an internship, which we'll talk about later. But then you go on to, finally, when you get to the end of that whole path, you get a license in the state that you'll be working in. So we'll give you a little more details along the way, because there are many kind of subsections of each step that's important to note. Dr. Brown?
So what is a neuropsychologist? And that's always a big question for everyone, because it's not a term that you hear every day. A neuropsychologist is basically someone who's a psychologist with a specialized expertise in understanding how the relationship between brain functioning and behavior. And so within the specialty of neuropsychology, you can test people, you can assess their clinical functioning, but it's definitely one of the more, from my perspective, one of the more fun and interesting aspects of psychology. But there are other health fields that you can go specialize in within the field of psychology. For instance, in health psychology, you can work with individuals who have had a stroke, who have had cerebral palsy, Parkinson's disease, understand their cognitive functioning, but also understand the emotions that they're going through in their recovery process and how the two are intertwined. In addition to that, you have rehabilitation psychology, something that myself and Dr. Connor are very familiar with in our time at NYU. Within rehabilitation psychology, you can work on an inpatient unit right after someone's medically stabilized and they need 3 weeks or a couple of months to recover before they go home or to another facility. But you can also be a rehabilitation psychologist in an outpatient clinic. After someone's medically stable and they return home, it's always important to have someone to talk to, but also understand the impact of your medical recovery on your everyday functioning. As many of you know, oh, sorry. As many of you are familiar with, there are school psychologists, and school psychologists have a number of opportunities to work with students, whether it be to understand how their educational experiences are affecting their emotions, but also understanding the importance of their learning disability or their ADHD symptoms on their daily functioning, especially in the school environment. So they work very closely with students, with teachers, with learning specialists to really help a student showcase their best. And forensic psychology is also very interesting. With forensic psychologists, you can work in a variety of settings, but for the most part, you're working with individuals who have had legal cases, whether that be a legal case associated with a car accident or even a prison sentence. Any number of ways a forensic psychologist can work with individuals within the legal system. So what do neuropsychological tests measure? And as I noted before, neuropsychologists understand the relationship between brain functioning and behavior. So the start to that is understanding what parts of the brain control what areas of behavioral and cognitive functioning. So if we look at the blue area, that's the frontal lobe. It's the front part of our brain, and it's associated with our reasoning, our judgment, our ability to concentrate and focus for long periods of time, our emotions, such as impulsivity, our physical functioning, how well we can move our body, our short-term memory. And short-term memory is basically if I give you information, are you able to recall it a few seconds, a few minutes after I give you that information? So that's the frontal lobe. The temporal lobe, which is the yellow area, is right underneath the frontal lobe and the parietal lobes. And that really focuses on memory functioning and understanding language. And this is one of the key areas that are impacted if someone has dementia. In addition to that, you have the pink area, which is the parietal lobe. And that's really an important area for understanding sensory functioning. So someone's ability to smell, to taste, to touch. Their hearing and understanding of language can also be impacted if let's say someone has a stroke or an aneurysm in that area. And a stroke is there are two types of strokes. One can be where there's a blood clot and blocks blood flow. And another type can be hemorrhagic, where there's a bursting of a blood vessel after there's been a clot, and which is similar to an aneurysm in some ways. And so that's why you can see these unique areas being impacted for any number of reasons, whether it's a head injury or because of the vascular system. In addition to that, you have the occipital lobe. And the occipital lobe, we often take vision for granted, but it really is critical in understanding your visual layout. So it's the reason why we don't get into car accidents frequently. It's the reason why we don't trip over each other while we're walking through the hallways of school. It really helps us process all this information that's in front of us and puts it in a way where it's not only digestible, but helps us kind of go through life in a very safe way. In addition, you have the cerebellum, which is underneath underneath the four lobes, and that really focuses on motor coordination, balance, and attention. In addition to that, you have the brainstem, which is very critical in things that are involuntary, things like breathing, heart rate, our body's temperature. Dr. Hunter, okay. There are many steps to becoming a neuropsychologist, and as many years as it can take, it's all very interesting and pulls you into a specific field that you'll never be bored in. I definitely can say myself and Dr. Connor have really enjoyed the work that we've done over the years and continue to. So obviously you start by graduating from high school. You apply to college and obtain a bachelor's degree in 3 to 5 years. Uh, a lot of times people go straight to a doctoral program, or they may obtain a master's and then eventually apply to a doctoral program. Some people go straight to from college to a graduate program, and others take what's called a gap year or time off to kind of relax, learn about life, maybe even have a family. Within that doctoral degree, you can get a Ph.D. or Psy.D. or also an educational degree, which are all doctorates. And for some doctoral programs, you have a terminal master's where you can obtain a master's degree after 2 to 3 years. But for other programs, it's all or nothing. So either you complete your doctorate in 5 to 7, sometimes 8 years, or you don't, and you don't obtain your master's degree or your doctorate degree. In addition to that, neuropsychologists will do 2 years after they complete their doctorate in what's called a postdoctoral fellowship, where they really focus on the relationship between brain functioning and behavior and emotions. And from there, they may also pursue a board certification, which some people pursue, and for others, it's not necessary.
Dr. Brown, I'm sure people may be wondering, why in the world would you go through such a long journey to get where we are? But hang on, we'll tell you as you continue to listen to it.
So the work activities, it's as Dr. Connor just noted, why would you do this? Because it is so engaging. You're entering a field where you'll never be bored. You meet a variety of people, and there's constantly an opportunity to learn and to help others. So the work activities of a neuropsychologist include assessment, it can include paper and pencil testing, um, conversations or a clinical interview with a patient, with a teacher, with a parent, or other medical professionals like a speech therapist or a medical doctor. Um, as a result of combining all that information, we are able to make a diagnosis, which is interesting, but that's not the thing that we really enjoy the most. It's really trying to give people concrete and helpful interventions that they can use in their everyday life so that they don't feel as sad or depressed. They have clear ways to address their difficulties with concentration. If they're having a hard time reading a book after a concussion because they can't concentrate, or remembering names of people, or organizing their day, all of those things are really helpful and critical for us in terms of our work as a neuropsychologist. And providing recommendations are not just for the client, but also to the family. We often make, especially for pediatric clients or individuals that are range in age from 2 years old through 18, as well as mothers, fathers, and people who are taking care of their grandparents or elderly relatives. So those recommendations are so important, and we really enjoy giving them so that we can be helpful. The work settings that a neuropsychologist can work in can vary so much. I myself have worked in hospitals, and now I work in an outpatient clinic where people come into my office, and I do a lot of work with people via Zoom in terms of interviews. You can work in an outpatient medical clinic that's associated with a hospital, similar to what Dr. Connor does, where she works at a hospital, but it's an outpatient clinic. So people come from home to see her and then go back home. You can also work in a school. You can work with the VA or the military after someone has had a concussion or some type of head injury or medical issue that's lead to changes in their brain functioning. In addition to that, which is something that we do at NFN, is sports medicine, treating people after they've had a sports-related injury to their head. So whether it's after being hit by a ball or being tackled, understanding how their brain functioning is after those injuries is really critical. And then, as I mentioned before, in the forensics and legal settings. And we work very closely, not just with each other as neuropsychologists, but also with speech therapists, occupational therapists, physical therapists, medical doctors, art therapists, horticultural therapists, depending on where you're working. So there's a variety of people that you can work very closely with to really help a person maximize their strengths and counter their weaknesses.
So some of the populations we serve, just like Dr. Brown said, there are, the pediatric populations. So when I did my work at A.I. DuPont Children's Hospital, I often saw, I actually was working in a pretty busy concussion clinic, but I often would, not only test folks that had a concussion, sometimes they were diagnosed with autism spectrum disorder, or they had ADHD or ADD. And so some of those conditions, were the conditions that we treated. There are also the geriatric population, which is the older population, and, working with folks who may have dementia or Alzheimer's, of the Alzheimer's type. And, thinking about conditions across the lifespan. So at NYU, in New York, I have seen every single diagnosis here. And, I am always presented with different diagnoses, different medical conditions that I did not anticipate working with. And so that has been really interesting to, work with different populations, with folks with different medical conditions. One of the things we always think about, or we keep in mind, is that, before they had their medical condition, before you had your concussion, there may have been things that you were already struggling with, like anxiety or depression or other conditions that may impact the medical condition. We also, when we think about neuropsychology, athletics is a huge area, as Dr. Brown said. At NFM, we've been fortunate enough to, we work with a lot of NFL players. So these are retired NFL players who we are testing, through the NFL to see, what impact perhaps these multiple concussions have had on their life. So we've seen and heard some very interesting stories. And again, it's fascinating actually, and when you're interviewing this previous NFL player, it's always interesting to hear like the life that they led and, where they are and, also how we can help them. I'm going to skip around to one other area that I think is interesting is aviation. So neuropsychologists are often very much involved in testing our pilots. So it's really important that your pilot, for anybody that's flown, you want your pilot to have good problem solving, to know when to land that plane or when to make an emergency landing, to be able to think on their feet, to be able to have good memory for, operating this aircraft. So neuropsychologists actually have a pretty hefty role in the aviation, area. So when you think about neuropsychology, oftentimes when we're having these conversations, it's like, well, who is this a good fit for? Because a lot of times people have never heard of the term neuropsychology. They've heard of psychology, but not this term. I gotta say, if you're a person who is really curious, I think this is a great field for you because we often get all kinds of different presenting, people who present with different issues. And, it strikes our curiosity. I feel like a lot of times, Dr. Brown, we do a lot of problem solving and investigation. So we don't work for the police department, but I tell you, there are times where we're reviewing lots of records and we're, having lots of interviews. And sometimes there's an interview with the individual we're testing, but also there's an interview with the family member or somebody from the school. So we get an opportunity to share a story through a written report. Sometimes our reports can be, 5 pages to 20 pages. So it does take some time to score all the things that we do when we do the testing. If you're creative, if you're detail oriented, if you like interacting with people. So let me stay there for a second. You may be somebody who's like, oh my gosh, I do not like being social. I'd rather do things alone. So neuropsychologists can play a role in doing research and, perhaps working for the Department of Defense or, working for the government. And so it doesn't mean that you always have to interact with people, but it does in the role that Dr. Brown and I have, it's very much a big part of what we do. Having organization, enjoying collaborating with others. Again, we're investigating a problem. If a client or a patient comes in and they said, hey, I have this concussion and I'm having a hard time focusing, or I'm having a hard time remembering the details of my conversation, and it's really annoying or it's isolating. We're going to do some testing. We're also going to take in as much information as we can and give them a summary, give them some answers in terms of what's going on with their brain. Also someone who's open to lifelong learning, hence the GIF over here. With Jimmy Fallon saying, even as we complete our education, there's many questions that still remain. So that you have to be okay with lifelong learning, and that's something Dr. Brown and I have become adjusted to. So I'm going to talk a little bit about my journey specifically because you all have seen a bit of the diagrams in terms of like the schooling and all the things that you have to do. But I'm going to highlight just a couple of areas, of how I got into neuropsychology. And you can see on the screen, the different things I did in terms of training. But when I was in graduate school, one thing that's really important is you do what they call practicums. And in those practicums, you get to, basically look through a bunch of different options for wherever you're living to see, hey, do I want to do a practicum where I work with kids who have autism, or do I want to do a practicum with folks who have traumatic brain injury in a VA hospital or a medical hospital? excuse me, do I want to do a practicum training where I'm working in forensics? And so I did 3 year-long practicums, and that meant I got 3 different years of experience while I was in graduate school. Honestly, it wasn't until I got to my internship program that I really understood what neuropsychology was. One day I went into my supervisor's office and he was telling me about a patient that had a traumatic brain injury. And he said, "Hey, Felicia, do you want to see this patient?" And oh my gosh, apparently I was known as the person who always said yes to everything. So I ended up saying yes. And boy, I didn't know what I was in for. I said yes to that client. And I was so fascinated by working with this person who had a traumatic brain injury, but was really trying to figure out how to remember information. And so I ended up going to work with him. I ended up working with him in his home. And that was different because the training I had before, I'd done a lot of work where I was working in a clinic, but that's how diverse this field is, where I got to go into the person's environment. He showed me that he was having trouble remembering when to take his medications or when to go to different appointments. And so we created systems, we created strategies so that he could, function the way that he needed to again. And so that was so cool to be able to solve this problem. And, I also spent some time, working at AI DuPont Children's Hospital. And there's a case that I'll share in just a few minutes, but it gave me a real opportunity to see, how many folks in Delaware, lots of school-age children and lots of teenagers who either had concussions from playing sports, or it was simply just freak accidents where they just got hit on the head or they hit their head on a cabinet. And then they were, having these difficulties in school. So for me, my journey into neuropsychology was one that just started with getting one client that had a brain injury, but then I was kind of hooked. I was like, well, gosh, what else can you do with neuropsychology? And so I started really seeking out other opportunities, really finding someone that would mentor me, and then just understanding like, wow, there were so many things that this degree could do. So this image here is this little boy who's being asked, when are you done with grad school? So when you go on this journey, like Dr. Brown and I did, a lot of times your family is asking, so when do you graduate? When are you done? And you're like, oh, I got something else I have to do even after after I finish this. And so this kid is he's really excited about the question, but what you don't hear is him crying at the end because he's like, oh my gosh, I do have more training that I have to do. But again, it's worth it. So we wanted to showcase what a day in the life is for us. When Dr. Brown was on the inpatient unit, when she worked at NYU, this was a typical day for her where she spent, actually, she sometimes would get to the hospital very early. Dr. Brown, they should know that you would sometimes get there at 4:30 a.m., 5 a.m. Because she liked getting to the hospital early so that she could spend time with her patients. Because one of the things you learn about the inpatient unit at a busy hospital like in New York University is that there are other therapies coming in. So when the neuropsychologist goes to see the patient, they may have to wait until other therapies have seen that patient. So as you can see, she starts first by reviewing the list of all the patients that are on the unit, and then cases are assigned to interns or to the neuropsychologist. There are morning meetings that you can see there. And then from there is from about 10:30 to 12 o'clock, she is going from room to room and seeing those patients who are on the unit. So sometimes they're on the unit for a few days. Sometimes they can be on the unit for a month before they go into the outpatient unit or before they're discharged. So she's got a lunch break in there. The afternoon continues just like the morning did. And then, on average, she may see 4 to 8 clients per day. At the end of the day is not always over because there are notes that you have to do. So we always want to document on our patients so that someone else who's in the hospital can see what we did. And then there may also be running groups for other individuals who are having some of the same difficulties. So this is my actual day when I go to NYU because I live in Wilmington, Delaware. And when I go into the city, and that is not every day. Before COVID, I used to go every single day for I want to say 8 or 9 years. So my morning would start fairly early. At 4:30 a.m., I'd get dressed. I'd go to the train station and take the Amtrak train. Once I got into the city, I would walk about 25 minutes across town. I'd get to the hospital, and about 9 a.m., I'd see my first patient. And then from there, I may do some cognitive coaching. So that is retraining for the brain. So let's say I was, working with someone who had a brain injury or had a concussion, and they may have memory issues. I may be creating strategies so that they can work or so they could go to school. And then if I did, and oftentimes I do a full, what we call a neuropsychological testing or evaluation, and I would give them a test that looked at their memory, their attention, their processing speed, how they function. They would get a couple breaks in there, and then we'd score all of those measures. And we'd often bring them back another day so that we can give them the results. Because when you do this type of testing, the child wants to know, or the adult wants to know, like, well, what is happening with my brain? Can you tell me more? And that's what we do. We tell that story from our testing. So around 5:45, I would leave NYU. I'd take the train back to Wilmington, arrive home, and sometimes get home fairly late. And so, when you're living in Wilmington for 10 years like I have, and you're going to New York, I mean, I think what I've loved is just being in that city, and the fact that when you go to New York, there's so many other opportunities and different diverse people that you get to meet. Private practice is slightly different. So that's what Dr. Brown and I do with NFM Brain Connections here in Delaware. Oftentimes, and this is an actual schedule of NFL players, usually when we test, the NFL does, they like us to do a very full, comprehensive evaluation. So, this retired NFL player is going through a lot of different testing. We often start with an interview, and that's our opportunity to ask lots of questions about, their history. We'll often ask them, how many concussions do you have? Dr. Brown, I feel like we always get the answer, like, I have no idea. I've had so many concussions that I can't even count them. Usually the answer is numerous. We'll take a break in there, and we'll continue the testing. We'll send them off for lunch. And then we'll do testing for another 4 or 5 hours. We'll have them take a couple of breaks. And then at the end of that, we talk to their spouse or their partner just to get some information about how this NFL player is functioning. And from there, we review the records. And then in a few days, we'll spend some time, giving the history, giving them an idea of what we found. The report writing, like I said, could take 10, 12, hours, but that's spread out. The more of these you do, the faster you get. So Dr. Brown's going to talk a little bit about concussion.
Yes, so concussions happen after any type of head injury that affects the brain. So let's say you fall and you hit your head, you have a gash on your forehead, a little bit of blood comes out. That doesn't mean you have a brain injury. The brain injury is what is defined as the concussion, where for some people, they lose consciousness. For other people, they may have difficulty with concentration, have a headache, feel wobbly on their feet, have difficulty with sleep, have difficulty recalling names. But for concussion in particular, it's really important to know that it's not just injuring the outside part of your head, your skin. It's not that at all. It really is a brain injury. And it happens when anyone is in a car accident, or let's say if they're in the military and there's a blast. It can also happen during sports, as we both discussed, where someone is tackled during football, or they're hit in the head with a soccer ball or a football. But it can also happen if someone's just kind of doing mundane things like shopping at the grocery store, and a large item falls on your head, or if you're at work and something falls on your head, or you slip and fall on ice. And it can happen in a number of different areas, like I said, if you're playing sports, at work, or at home, or in a car, or if you're in the military in a war zone. As we just discussed, it's really important to know what those sources are. But also, like, as we just noted, it can also happen if you've had a car accident or even a fight. And this graphic is really, really helpful as it relates to your brain during a concussion. So a head injury can happen with, a laceration or a cut to your face or a bruise to your face. But the reality is, with a concussion, as you see, the brain is kind of like this jiggly substance, and it's floating in cerebral spinal fluid. And that fluid doesn't allow for the brain to stay in place. So if you're in a car accident and your head is suddenly thrust forward or thrust backwards, or if that happens during a fight or a fall or something hits your head, that can lead to the brain hitting any part of your skull. If the front part of your brain hits the front part of your skull, that can lead to some of the difficulties we just mentioned, which are difficulties with attention, impulse control, mood, your ability to recall new information and remember things. All of those things can happen as a result of the concussion. So always keep in mind this graphic when it comes to a concussion. It's not a head injury, it's a brain injury.
So we wanted to spend some time just, discussing a case. I mean, goodness, when we were thinking about different folks that we worked with, from very small children to the geriatric or the older population, there were a lot of different stories that came up between Dr. Brown and I. One that comes to mind for me is a young woman I worked with at AI DuPont, who, who's a 14-year-old, who had a history of ADHD. So she had some exceptionalities, some things that, were a bit of a difficulty before. She also had anxiety, but, before this, concussion, she really felt like she was a well-adjusted student, who ran track, who was fairly social. She, when she came into the clinic, one of the things she shared is that she was walking down like a highway on the kind of emergency exit, and she was with a group of friends, and a car struck a deer, and the deer hit her while she was on the side of the road. I got to tell you, as I was like taking the history, I couldn't really believe the story. I mean, it was one of the wildest stories I had ever heard. And, even when I was speaking to her, she had a bit of the hoof imprint, in her forehead. So clearly, she had a physical, not just a physical injury, but, she wasn't just impacted physically, but she was impacted from a cognitive standpoint too. So here I highlight the fact that she had her first concussion was when she was struck by the deer, but the second concussion is when her head hit the ground. So it's two concussions back to back. She had no other history of concussions, and she came to us because she was really having some difficulty in school. As somebody who was an AB student, she was really having a hard time keeping her grades on track. And she really was feeling isolated, a bit depressed and sad. And she didn't really have anybody to talk to because nothing like this had ever happened to her before. So here's some of the things that she complained about. She had, as you can imagine, chronic headaches. So these headaches were unrelenting. They would not go away, even at times when she was taking medication. She was really upset that, when she got on the computer screen, her vision was blurry. She was very sensitive to noise. And so she had siblings, a very small brother. And so, her brother crying, or, having that noise in the background was really distressing to her. Again, here's some of the issues that she was having in school. She could not concentrate at all. And she was, very forgetful. Now, on the outside, she looked just like she had always looked, pretty much. And, I think for her, she just was trying to understand what was happening. Now, she was given an impact test, which at that point, she didn't have a baseline test for us to compare it to, but an impact test would not have helped us to really understand what was really happening to her in terms of all of the different areas of her brain that she was looking for. She was frustrated, irritable, and sad. And this was beyond, what she would say is like, hey, I'm a teenager. Yeah, sometimes I'm just in a bad mood, but this was not the normal, bad mood. This was like really angry and frustrated. It's almost like her personality changed. And that was not who she was before. She had difficulty sleeping, falling asleep and staying asleep. So as you can imagine, if you're in school and you're not able to fall asleep, and then if you do fall asleep, you can't stay asleep, that's going to impact your day. Even if you drink lots of coffee or caffeine or energy drinks, that will probably still have an impact on how you learn. So with that particular case, we did some neuropsychological measures, and we were able to give her lots of recommendations. Now, she came to DuPont for several months, to get cognitive training, which is that cognitive coaching we've been talking about, to give her some more strategies so that she could function better in school. One of the things that she also did, we were able to be in touch with the school to make sure she had accommodations. That's really important for when you're returning to school, to make sure that, you have those supports in place so that if you're not functioning or you're not doing as well as you were doing before, somebody can help you with that. And those accommodations do help you indeed. Dr. Brown's going to talk a bit about one of our NFL players that we tested.
And as Dr. Connor noted, we see a variety of clients, but one of our specialties is working with retired NFL players who have had multiple concussions and are experiencing a change in their behavioral functioning, their cognitive functioning. It's harder for them to concentrate, remember things in day-to-day life. And it's something that they're not only noticing, but their loved ones also. So a lot of times, almost every time, we also work with a person's spouse or their adult children to see what's going on and are we getting the full picture. So one of the clients that we worked with played for the NFL for 6 years as a tight end, and was in the NFL after completing 4 years of college. At present, he's retired. When we worked with him, he was retired, but also working part-time in real estate management for a residential property that had 2 buildings. He lived with his wife and had 2 adult children, and the adult children lived outside of the house. So it was just him and his wife as empty nesters. Uh, as Dr. Connor noted before, it's really hard to pinpoint how many concussions an athlete has had, especially when they're in a contact sport. The most significant usually is someone who plays football, but it can also happen when people play soccer, do snowboarding, any number of sports where there's just a high risk of falling or being hit by something. And for him, he assessed that maybe he had at least 6 concussions. And oftentimes, the interesting thing about concussions, we also often think about it as that moment when we're watching a football game and someone kind of falls out and has a hard time getting up and is pulled out of the game. But in reality, concussions when playing sports don't all only happen during the big game day. They oftentimes and more frequently happen during practice when it's not a game day. And for someone who is a professional and has gone off to play with the NFL, they haven't just been playing, football for the 4 years of college. Most of the time, they've been playing football since high school, throughout high school, and maybe even during middle school or grade school. And so it's really, as I noted, it's really difficult to pinpoint how many concussions they've had, but more than likely if you're dealing with a retired NFL player, you're dealing with someone who's had multiple concussions over their lifetime. For him, he was reporting his wife was reporting a number of difficulties that were so different from the husband that she'd known since high school. He was having road rage incidents where it was really difficult for him to control his anger. And actually, he wasn't able to control his anger if he felt someone had cut him off or didn't let him into a lane when he wanted. And that was so very different from his personality. His wife kind of described him as a gentle giant. And it was so shocking and scary for her to see him have these road rage incidents because he couldn't pull back. And that's part of the frontal lobe, where it's hard for you to control those impulses. We all have things that we want to say throughout the day, but we filter it and pull ourselves back. And when you've had frontal lobe damage or degeneration as a result of multiple concussions, you're more likely to have those road rage incidents over time, but not necessarily. His wife was also noting that he needed a lot of reminders to do things around the house. He was very handy, but it was really difficult for him to remember, okay, I have to take out the garbage, I have to fix the fan. And that was so different from his personality 15 years beforehand. If he was going to the grocery store for the family, he needed a list, and even with a list, he'd often forget things on the shopping list. And when traveling outside of the neighborhood, it was really likely that he'd get lost. So he only traveled locally to stores and shopping centers that he was really familiar with. And then for the player, he it's interesting because sometimes when you're working with clients, they'll give you a lot of information, but it's so critical to get the information from the partner because even with all the information he provided us, he didn't give those examples of the road rage incidents or the fact that he was getting lost in his neighborhood. So that's why it's so critical that we work with families and not just get information from the player or anyone that we're working with. From his perspective, he was noticing that it was hard for him to control he was having incontinence. So he was having bladder accidents, which was very new for him. But he also had a really long history of headaches, chronic neck and back pain. And over the years, he'd started to feel nervous and anxious when driving. There were definitely times when he couldn't figure out why he felt sad and was crying a lot. And he was really worried that as a residential manager part-time, he was really worried that um, he was having memory difficulties because there were calls that he had missed when clients would come to look at an apartment or set up a meeting to go through a leasing agreement. He would forget things, and he was really nervous that this would not just be noticed by his coworkers, but it would affect his income because he was afraid that he may eventually become fired. In addition to that, it was really hard for him to stay asleep. He'd wake up for 2 hours at a time, fall asleep, and then wake up several times per night, and stay up for long periods of time. And so as a neuropsychologist, there are so many things that we looked at. We did testing with him to look at his attention skills, his memory, his impulse control, his ability to kind of be flexible in his thinking. In addition to that, behavioral observations are really critical. We always want to see if someone's giving their best, if they're comfortable being there, if they have a lot of pain. I know for myself and probably for all of you too, if you're in pain, you're just not giving your best. And if you have pain, let's say a 9 out of 10, and even with someone who has chronic pain, they may usually have a 4 out of 10 or a 5 out of 10. But if you ramp up to a 9 out of 10 or a 10 out of 10, it's really going to be hard for you to do your tests, the tests that we want you to do. So sometimes we'll pull back and say, okay, let's come back and reschedule for another day when you have less pain and you feel better. So behavioral observations are really crucial to make sure we're seeing someone at their best. Um, and throughout the testing, he was really pleasant, engaged. He wanted to be there. He wanted to do his best. One thing that Dr. Connor and I noted with the retired NFL players is that they have that competitive spirit and it doesn't go away after they've retired. So they're constantly kind of beating up on themselves, even during the testing, if they feel that they've gotten an answer wrong. So he was really frustrated and disappointed in himself when he felt like he wasn't doing things as quickly as he wanted, and concentrating or remembering as well as he wanted. And so, as I noted, the neuropsych test covered a wide variety of areas like attention, memory, visual spatial skills, thinking speed, and executive functioning, which is planning, organizing, and impulse control, and a number of other things. As a result of the testing, we noted that there were cognitive deficits, particularly around memory, as well as his frustration tolerance or impulse control and attention. So with cognitive remediation or cognitive coaching, we give very specific, and Dr. Connor is better at this than I am, but we give very, very specific examples of what they can do to not just improve on their weaknesses, but also strategies that they can practice at home, at school, and anywhere when driving that can really help counter the difficulties with attention or memory or impulsivity. In addition to that, we don't just focus on the brain and how to improve your cognitive functioning, but one thing we know from all the years of experience that we have, as well as a lot of research, if someone is depressed or anxious, or having a hard time sleeping and just always tired, that is going to show up on their testing. It's going to show up in their ability to concentrate, reason through a problem, their memory, any number of activities that they do in the room with us can be impacted by that. But for anyone who's had long-standing concussion symptoms, they often feel a sense of sadness, that the life that they had before the concussion hasn't returned. They're anxious about people seeing their deficits because they consider them weaknesses. And so they're and they also have a sense of grief over losing so much of their independence. And so we often recommend talk therapy or psychotherapy to help with managing sleep, anxiety, sadness, or depression, and just adjusting to their new life after having had a concussion.
So I think it's important to note, and thank you, Dr. Brown, for sharing those, last thoughts. That, a lot of times when it comes to, working in this area, seeking out a neuropsychologist usually comes, about 3 months after a concussion. And typically, concussions do resolve on their own. For most people, the research also says that, most will experience, they'll return to baseline or close to where they were before, but there are some who haven't. And I guess here I'd like to share that I've had 3 concussions, and it's very interesting for somebody who evaluates concussions all the time to have had them myself. And it wasn't while I was playing sports. It was I hit my head on a cabinet or I hit my head on the fireplace mantle. And when I had my 3rd concussion, that's when I noticed some visual changes that have stuck with me. And so I ended up seeing a neuro-ophthalmologist, so somebody who really focused on not just, working on the eyes, but also giving me eye therapy to help with my vision. So I got to say, for years and years, I'd work with people at concussion and they would share their story and they would share some of their difficulties. But I really felt like I could resonate with it when it happened to me. And you would know that I've had 3 concussions. And I don't live in a bubble. I didn't stop doing all the things that I was doing before, but I am very aware of, some of those visual changes. So, when is a neuropsychologist, when should you seek someone out like us? Usually when you're having difficulty in one of these areas, whether school, work, or daily activities, For sports, one of the things I think is really important to talk about is oftentimes, when I'm working, especially when I'm doing cognitive coaching, and coaching kind of in the sense of like if you're an athlete and you have a coach, that's some of the work I do with just cognitively creating strategies, almost like creating plays, creating opportunities for you to, for your brain to relearn this information in a different way. A lot of times high achievers, and I'm sure there are a lot on this, on this webinar, high achievers are often very hard on themselves because they're not performing the way that they always did. And so sometimes anxiety can be a barrier for getting better. And sometimes that's a part of the cognitive coaching, really working with the individual to show them, that they are getting better or they are improving or that there are still things that they can do. So again, whether it's work, household tasks, sports, or driving, those are all the things, that you want to note if you're seeking a neuropsychologist. And, lastly, thinking about, the assessment, comprehensive assessments like the ones that we've been talking about have been really helpful in like targeting the problem and giving folks the answer. So in knowing like, oh my gosh, this is what I'm dealing with, and this is why this area of my brain has been impacted and I'm having trouble with memory, and this is what I do about it. Oftentimes, folks will ask us, okay, I've seen the medical doctor, I've done the things that they've asked, now what's next? And, I'm happy to say there is a next, like there is something that you can do about it through cognitive coaching, whether it's virtual or in person. But also sometimes consultation. So consulting with your school, making sure there are accommodations or there are resources there so that you can have the help that you need. I gotta say, Dr. Brown, like I know when I first started out, when I was in high school and college, like I did not see my life going in this direction at all. Like I could not have predicted it, but I really feel like it's helped me to see neuropsychology or psychology in such a different light, and to see that there are a lot more opportunities that you don't often know. One budding question that sometimes people ask me is, how much do neuropsychologists make? And so I didn't put a slide for that, but I would say on average, neuropsychologists make somewhere in the neighborhood, and this depends on if they're doing full-time work or assessment work. They could make somewhere between, like on average, 125,000. On the higher end, it could be $200,000 a year. So it is an area that does pay well. There is hard work that come along with it, but it is an area that does compensate you too, whether you do private practice, you work in a hospital setting, or even for the government. So with that, that concludes our presentation. And of course, we're going to stick on as long as possible to answer any questions that you may have. And I will stop the share, Tim, if you'd like me to.
Yes, please. And questions we have. All righty, let's see where to start. So remembering that these questions come from the very beginning of the presentation, in no particular order, is there anything you could recommend for a middle schooler that they should be studying to get into medicine? So middle school.
So anything that they should study to get into medicine or like psychology or?
Right, all of the above.
All of the, Dr. Brown, do you want to take this or?
Sure. So I know for myself, when I was in school, we learned about human development, and there were classes on that. But I think not just human development, psychology, health courses are all really important. But being well-rounded is also just as important. And you'd be surprised, you probably wouldn't be surprised by how many people gravitate towards you because not only do you have good social skills and you're really personable and empathic, but you are, from your own experiences, understanding what they're going through. If you played sports yourself, your client knowing that you've played sports can really help you create a bond where they feel comfortable with you and are open to talking about some of the things that they're really embarrassed about. So, not just the obvious coursework, but also being a well-rounded person who has experiences that help you build empathy and relationships.
Right. The other thing I might add to it is that if in middle school, as when I went to school, middle school, we started learning a foreign language. Picking up a foreign language, something other than English, especially in Delaware, learning Spanish, can be a real advantage if you're a healthcare provider. I don't think many schools are teaching Haitian Creole, but that would be another big advantage. We've got a growing Haitian Creole population and very few people who speak Haitian Creole. Okay, next question. Color blindness, is that damage to the occipital lobe or is it unrelated?
Dr. Connor, you want me to take it?
Yeah, sure. I was in Tim, I was just going to add something more to what you said.
Oh, sure.
Yeah, I went to a language school in Guatemala when I was in high school, and something I would highly recommend, as well. So I'm glad that you made that point. But the other point I would also make is if you're a middle schooler thinking about like the medical profession, like my husband's a physician in Delaware, oftentimes we have students come in and they volunteer. So whether it's the summer or your spring break, identifying a medical provider who would love to have you come on board and just to see what a day looks like. More medical providers are more open than you think to doing that. And that was something I would highly recommend too. Sorry about that, Tim.
No, absolutely. Okay, color blindness. Damage
Yes.
to the occipital lobe or unrelated?
That's a great question. So just to describe briefly what color blindness is, it's a difficulty recognizing colors, whether it be the difference between red and green, or for some people in more rare cases, it's difficulty seeing shades. So a lot of times they may just see gray or just in black and white, but that's pretty rare. And for a lot of people, color blindness is a function of genetics. Their genes just made it really difficult for them to see certain colors, certain shades. But for other people, it can even be as simple as a side effect from medication. Or for other people, it could be due to vascular issues where they've had a stroke or aneurysm in a certain location. So the person asks the specific location. Yes, fully. The occipital lobe is very critical in terms of seeing colors, but also for a lot of people with color blindness, it's that junction between the occipital lobe and the temporal lobe. The temporal lobe, as we noted before, has to do with memory. So when you have color blindness, it's not just what information is coming to your eyes, not what you're seeing, not just what you're seeing, but also your ability to recognize what you're seeing. And that has to do with memory. So it's, yes, the occipital lobe, but also that junction between the occipital and temporal lobe that really impacts most people with color blindness.
All right, thank you much. Do you think physician assistants can integrate into your field? Do you work with physician assistants and how do they help you?
Yeah, I'll take this, Dr. Brown. Yes, the answer to that question is yes. I think that PAs or physician assistants really can be instrumental. I know that when I worked at AI DuPont, we had a PA that helped with the concussion clinic. And so I think sometimes what PAs will often do is they're trained in working in concussion or brain injury as well. And depending on the kind of multidisciplinary team that you're working with, they can have a hand in, from the medical side of things, but it's, the PA working medically with the neuropsychologist to come up with a plan for that particular patient. So I saw that happening a lot at DuPont, and I think that's a fantastic model to be able to share resources among different teams.
All right. I believe that you may have covered this, but I'm going to ask the question again, just so for a nutshell response. Is this career connected to neurosurgeons or neurosurgery, and how?
Want me to do it? Okay. So it's connected with neurosurgeons in the sense that we can work very closely with neurosurgeons. Myself, I worked on an inpatient unit. As Dr. Connor noted, she works in an outpatient unit with individuals who have had a brain injury. So for myself on an inpatient unit, after someone's medically stable or even before they come to our unit, after they're medically stable. So maybe they're still having some difficulty with temperature control or blood regulation. We may assess their cognitive functioning. There's something called like a coma scale, where you can assess their eye movements, their responsiveness to pain, their responsiveness to commands. So if I say, open your eyes, open your mouth, their physical functioning, can they move their arm? Can they stretch out their leg? All of those things are really critical after someone's, immediately after someone's had surgery. And then when they're transferred to an inpatient unit, myself and other neuropsychologists, we'd measure their progress. So on a weekly basis, we'd give the same measure to see if their scores are improving. And then after they stabilize some more, they hopefully can go home, and Dr. Connor, an outpatient, would work, and myself, I would also work on their emotions, their depression, anxiety, frustration. And Dr. Connor would continue to do the same things with assessment of their cognitive functioning and working on ways to help them counter any mood symptoms like anxiety or depression, as well as cognitive remediation or cognitive coaching to help with improving their brain functioning and finding strategies to help them manage their daily life with children, school, driving, all of those things.
All right. It's no fun if one of the hosts doesn't get to throw in a question every once in a while. We hear a lot about the opioid crisis and pain management, which leads to thinking about the perception of pain. Is this an area that is part of your world, your focus?
So it's not a part of what we do from day to day, like through NFN, Brain Connections. But I gotta say, on a hospital unit, and I'm sure Dr. Brown, you saw the same thing, where you're working with people who have chronic pain and who now are addicted to these opioids, and their perception of pain is quite high. And so, now psychology is involved, from a mental health standpoint, to try to assess, are they really having this pain? Like in the perception of pain, there's so much research out there, but it's hard to determine just how they're perceiving pain. So a physician may say, well, it seems like, you shouldn't be in this much pain, but the patient is saying, yes, I'm at a 10, and their perception is that they should be at a 1 or a 2. So this is something that neuropsychologists in a hospital setting have dealt with and do, because sometimes, even as you're thinking about a brain injury or concussion, they may have become addicted after a particular surgery, and now we're dealing with two issues. So it is an area, we do have certain neuropsychologists who specialize in chronic pain conditions, and then using some different therapies like ACT, it's ACT, some different type of therapy interventions to really work with them on the psychology behind the pain, if that makes sense.
Thank you. No,
And can I add one more thing to that? Especially on the inpatient unit, you would sometimes see individuals who had overdosed from opioids, and it can slow down their cognitive functioning. It can lead to sedation. And so at varying degrees, you work with clients on the inpatient unit after an overdose to help monitor, but also improve their attention skills, their memory, and various aspects of their cognitive functioning and the emotional functioning of having had this experience happen to them, which is devastating.
Yep, absolutely. How important is baseline testing for concussions? Without a baseline, how do you know when somebody is better?
Oh, great question, Tim. And thank you to whoever asked that question. So baseline testing is important. It's something that I started doing at DuPont years ago. And when I first started it, we were able to do group administrations because sometimes when you're doing those group administrations in school, the test is not really valid because you're kind of hanging out and playing. And so we often would do them in the hospital setting so that we could monitor them. But I would say baseline testing is important. I think there are some new laws and regulations coming out in the state of Delaware that is really, kind of moving toward that area of requiring baseline testing for all, even if you don't play a contact sport. So I would encourage it if you could get that done. It would be nice to have something to compare it to, and when you don't have that, it's really just your best estimate, based on your training. So.
All righty.
And I'm sorry, just to add one more thing to that in terms of norms, we always compare you, we don't have baseline testing, we compare you to other people in your age group. So we don't compare an 8-year-old to a 13-year-old. We compare 8-year-olds to 8-year-olds and adults to adults at varying age ranges. So.
Okay, here's the flip side of the coin. I love questions like this. Would you say that you receive many unusual cases?
Many. Gosh, how many? Yes, we do. We have some unusual cases. We have the run of the mill, like, typical concussion, but we've had a couple of wild cards out there. Dr. Brown, how many would you say? Like, just give a number. What would you say?
Honestly, I feel all of our clients are unique and come with their own individualized experiences. So, and that's kind of what I was getting at in the beginning. It's a lot of fun and it's never boring, the work that we do. But some have more of a history that stands out than others. I'd probably say at least 30% to 50%, depending on the week.
I would agree. And I think it's like the case I presented, the pediatric case. Sometimes you get some very odd presenting problems. I think my question for the young woman who was walking on the side of the highway was, why were you on the highway with your friends? But beyond that, like, what a freak thing, so we do have some of those that stick out.
Right. Okay, so question from Pamela. What about medications? Do you prescribe drugs to address your patients' problems?
We do. Psychologists and neuropsychologists do not prescribe, but of course that's more of in the psychiatry realm. But we work alongside folks who do prescribe. In the literature, often will suggest cognitive behavioral therapy or some sort of therapy along with that medication for the most effective type of treatment.
Right. Let's do maybe a simpler one. What colleges do you recommend for neuropsychologists other than your own?
Oh, Dr. Brown, is that simple? Is that a simple?
I'm joshing.
It never is. I think there are a number of programs out there, especially being in the Northeast. Boston has a really great program. Queens College has a great program. There are a couple, I'm trying to remember offhand what the great programs are, but honestly, any program that offers neuropsychology as a specialty and as a focus, it can offer you a number of wonderful experiences. I think the key is sometimes not just the program that you apply to, but the externship and internship opportunities that are available to you. That's usually the most critical because that will formulate your understanding of the neuropsychology field, but also prepare you in ways and give you networking opportunities in ways that other programs wouldn't.
And to add to what Dr. Brown said, so at NYU, I'm the training director. So I see folks when they've done, they've already selected their graduate school and now they've got to do a doctoral level internship before they do the fellowship. So if you're looking, to be accepted to an internship program, you want to have the right practicums, so the right training opportunities. So while you were in graduate school, maybe you did a neuropsychology practicum or you did a health psychology practicum, we have a little guest, or or you've done something in health psychology, so that you will be more likely to be accepted in an internship program and then be able to go on to fellowship in neuropsychology. So what Dr. Brown said is so key, and I review applications all during the year. And what I'm often looking at is, did you specialize in neuropsychology? Did your program have that? Or if you didn't have neuropsychology, did you have health psychology or rehabilitation?
Okay. How do you approach or work with patients who self-diagnose?
Good old Google.
Especially with TikTok.
Oh boy. So we tell ourselves, when we're having symptoms of anything, it's like, do not go on to Google. And Dr. Brown and I will have these conversations amongst each other. And it's like, did you see that on Google? I'm like, yeah, I looked that up. So do not do that. But what I would say to you is, if you come in and you have some ideas of some things that you're having concerns with, we can work with that. I think it's human nature for all of us to wonder what we have, or to compare with others, or Google or Siri, whatever, a resource you use. But when that does happen, we know it's typical. And so we provide a lot of education. We'll share, like, yep, we know that maybe you've looked at this resource that says this, but here's another resource that we would point you in that direction. So we're not going to just tell you not to do that. We're going to give you another resource that's like from a published journal, like a medical journal or something, to support what we're telling you.
And there's a lot of inaccurate information on Reels and even on the internet in terms of details about different diagnoses. So going to an expert who can help you differentiate between diagnoses that have overlapping symptoms is really important.
Right. Well, and there's that adage about everyone who goes to medical school has experienced every illness personally. By the time you're done,
Or given it to their children and wondered if their children.
The gift that keeps giving. Right. Sorry. Do you or your peers work with kids with reactive attachment disorder? I feel there's a huge hole in the medical psychiatric community regarding this disorder.
Dr. Brown?
So primarily if someone is having symptoms, emotional symptoms that are affecting their day-to-day. So if it's difficult for them to concentrate in school or at work, or if it's difficult for them to kind of handle daily life expectations. So, being able to, manage a pet or manage one's own children, cook, clean, all of those things are things that we would look at in addition to the reactive attachment disorder. So, but that would be the only time they'd be referred to us if there are cognitive deficits or changes.
All righty. Patricia asks, in your practice, do you have to evaluate a person's ability to make decisions on their own and determine if they need a guardian?
Yeah, so that's actually not outside of the realm of what a neuropsychologist has done. And so I think what you're speaking to is capacity evaluations. And so a lot of us have been trained to do that as well. Sometimes that comes up, let's say you're working with someone who's dementing, and you're wondering, okay, as a caregiver, when do I need to take that next step? So in our practice, because we focus a lot on concussion and other neurological conditions, sometimes we will do consultation related to that, just given our knowledge, or we may refer you to someone who we feel like can help out with that area. But again, that's not really outside of the realm of what a neuropsychologist does. Because that does come up, and we are dealing with cognitive issues. So it makes me think about some of these NFL players we've worked with. When do you have the conversation, with the spouse about, their ability to care for themselves, and to bring someone in. So that sometimes we are involved in that.
Right, that almost sounds like it's not only competency, but also capacity.
Absolutely, absolutely. So that
Yeah.
daily functioning, you know, are you able to do activities of daily living?
Yeah. And being pulled in to do a capacity evaluation as a neuropsychologist can happen in an inpatient unit or an outpatient unit. And you may also be called in for a hearing at court. So, which is not bad. Don't worry, you're seen as an expert, as someone who knows the client very, very well. But you can wear many, many different hats as a neuropsychologist.
Right. Well, there's a question here, but I have a feeling it was very particular to something you said. So sorry, Miriam, we're going to dismiss that particular one. Tell us a little bit more about what happens if each lobe is damaged. Shreya, you asked that question. You might want to type in a little bit more about what you really mean. Yeah, maybe she'll type more there.
So just a side note, sometimes that can happen when there's a decrease in one's heart rate. And as a result of that, they may develop hypoxia or anoxia. And so you can see difficulties with vision, memory, attention, movement, and coordination. A lot of times that happens after someone's had a swimming accident where, you know, they haven't been able to breathe. If they have a stroke or blood clot that occurs in the lower regions of their brain, like let's say the brain stem. So sometimes that can actually occur after those incidents and cause anoxia or hypoxia, where multiple regions, maybe not all of them, but multiple regions are affected because of the loss of blood flow, which carries oxygen and nutrients to the brain and feeds it.
And then a heart attack as well, at times can cause some of that same, you know, instead of just one area, diffuse, like all over.
Right, right. So this question's related to teens. With always being tired and sleepy, what can cause this?
A number of different things. So hormonal changes, we know, is a part of it, but I think also there are a number of different factors. And this is something Dr. Brown and I have been speaking about a lot, and it's related to how overstimulated we are with our devices. Dr. Brown was just sharing a very interesting fact about, you know, visual changes from looking at, you know, small devices. So I'm thinking about our cell phones, which we all have, and it's very hard not to scroll. It's extremely difficult, and so sometimes fatigue, and you know, that tiredness is actually coming from overstimulation from your device. And you know, so something to note, and I think Dr. Brown, you were just telling me the other day, you know, screen time less than 2 hours, right? For to prevent different visual changes. So eye fatigue is actually happening a lot more than we think. So when you have eye fatigue or visual fatigue, it actually can manifest into physical fatigue. For folks who have had concussion or brain injury, the term we use is neurofatigue. And so some of that tiredness, some of that, you know, lack of energy may be related to rest. How much sleep that you're getting per night? Are you getting restful sleep? Do you have a sleep routine? Okay, I'm not going to even, you know, for some people, it's like, no, you may not be getting enough sleep. I also think sometimes it's the, you know, sometimes the weight of all the activities we're involved in. When it comes to sports, and I don't know about you all, but sometimes I've heard families say, okay, my kids can only participate in one sport. I know kids who are participating in multiple sports. So not only do you have the demand of sports, but also the demand of school. If you're working, that's another demand. So I think we're overly tired, especially teenagers. I think sometimes it's getting good quality sleep. But then also, you know, thinking about how much you're doing on your screen, which really does impact your fatigue level.
Right, right. So I'm thinking Elon Musk here. What upcoming technologies do you anticipate which might affect the field of neurology? How is technology playing a role in medicine in general?
Okay, so with neuropsychology, we are already seeing the impact of AI or artificial intelligence in our daily life. People are coming up with programs to help with report writing, which is often the part of the neuropsychologist's job that is the hardest and takes the longest. So getting results quickly and efficiently is really important, and AI can really be helpful in that. There is a question about whether or not AI can help with administering tests, especially ones that are more paper and pencil based, as opposed to ones where you have to answer a question verbally and I have to interpret it. So things that are more straightforward and basic can be helpful if someone incorporates AI, but also in the report writing process.
Right. I just
And I think,
read an interesting article about whether AI can be stripped of cultural bias, so that AI could be doing an assessment and not bringing its own baggage to the table and skewing results accordingly. Interesting thing. I'm
Yeah.
sorry. I
So
interrupted.
no, I
Dr.
agree.
Burke.
So far, that's a very weak aspect of AI, who AI has been normed on, and it doesn't always apply to every population and every gender and racial and ethnic group. So
Yep. Uh, what has been the most rewarding and or surprising part of your jobs so far?
I can say for myself how often I enjoy learning new information on the way to work. I love listening to podcasts about any range of topics. And I think the importance of podcasts and YouTube is really critical because that is giving an opportunity for people who have experienced a diagnosis to tell their personal experiences and help me better understand what it's like to be on the other side of a diagnosis or a disorder. So that for me has been the most interesting and helpful.
I think
Um,
I'll just speak on that real quick, Tim. I think two things really stick out to me. I think mentorship, like being able to mentor so many folks, whether it's school age folks or folks who are in college or, even in grad school in this field and connecting them with opportunities, learning, helping them learn how to make money. I think, even from a private practice realm, we didn't talk about that so much, but there are so many opportunities in terms of consulting and working privately. And I think that has been great. I think the other thing that sticks out is every time I work with someone who's had a concussion or brain injury and I share my story or I share a story of someone else I work with or I connect them to a resource, like their eyes still light up and say, oh my gosh, like this is the thing I've been looking for. And that I think I never get tired of that. I never get tired of seeing that person's look on their face like, oh my gosh, someone else had this? Are you kidding me? Because so many times you think that you're the only one and you realize there's so many people out there who have some of the very same issues. So I love.
Amen. Um, is ADHD treatable without medication, or does it really require meds to help deal with learning deficiencies and attention span deficit? Dr. Brown.
Yeah, I could jump into that one. That's a lot of my private practice, as well as autism and learning disabilities. So yes, you can definitely treat ADHD through behavioral interventions. However, I will say the behavioral interventions are not as strong or robust in terms of what you want to see improve. Attention, hyperactivity, and impulse control. And research really does show that medication, especially stimulants, are the most helpful in terms of reducing the ADHD symptoms. And a lot of times when people choose to take medication, especially for younger children, if they're diagnosed at 5 years old or 8 years old, there's a reluctance to prescribe medication to a child that young. But as I often tell parents, it's a personal choice, but the research really does show that medication alone is so much more helpful than doing behavioral interventions. And oftentimes the way to decide when to prescribe medication to your child is to say, okay, how significantly are their social experiences and their academic experiences, like learning new information in math, or reading and writing, how significantly is that being impacted by their ADHD? And that's oftentimes the deciding factor for parents in allowing their child to be prescribed medication for ADHD.
All righty, and following on that, is ADHD hereditary or is it caused by different factors experienced throughout life?
For a significant majority of people, there is a genetic component. Most of the time, you will find a parent or a grandparent or a first cousin or aunt or uncle who has also been diagnosed with ADHD. But as we know from a lot of the trauma research, if you've experienced trauma or if there has been in utero use of substances or alcohol when someone's been pregnant, that definitely increases the risk of developing ADHD. So sometimes it can be in utero, sometimes it can be a function of genetics, and then other times it could be a function of significant trauma throughout one's life.
All right. Sorry, I'm reading the one once they're left here and trying to weave a little narrative as we. Oh, here now this is an easy one. What are the personalities of your coworkers like? Are they nice, annoying, etc.?
I love that question.
All of the above?
I'd have to say, so most of the people that we work with are people we choose to work with, so I could say that. But a lot of the folks are very nice. We all have something in common in terms of, why we do what we do or why we love what we're doing. Every now and again, there is an annoying person. I have to admit it. And so, like Dr. Brown said, like you use that good old impulse control. You don't say everything you're thinking, but we we work together as collaboratively as we can. I work in a big hospital system, so there's always someone who's a little annoying. So I love that question.
Do you see speech therapy or work with speech therapists, and what's your experience with that been?
Yes, very closely, particularly on an inpatient unit. A lot of times we work on overlapping issues, whether it's comprehension of language, expression of language, how attention and memory and visual spatial skills are impacting their language skills. So and in developing a plan for cognitive remediation, things that can be helpful in terms of building their brain functioning so that they're better at language and other aspects of cognition. So I know for myself, I was constantly speaking to speech therapists on an inpatient unit. And to a certain extent, an outpatient also, if a client of mine is working in speech therapy, let's say for autism, working on social language skills. So
All righty. Kathy asks, and I think again, this was probably a point in time question. Interesting that in cognitive coaching with the ex-NFL players with CTE, she was guessing, maybe that was, well, anyway, it was said that their memory can actually improve. Question, is your NFL program here in Delaware?
Yes, we are in Delaware. And yes, there is research, cognitive remediation and cognitive coaching. They're kind of simultaneous. They're the same thing basically. But the research shows that cognitive remediation and coaching actually can be very effective. And the reason that it is because you're creating a new neural pathway. So you're trying to get to the same result, but you're using strategies to get to the same place. So if you imagine, driving down Route 1 and the road is closed, or there's a huge accident and you take an exit, you take another exit to get to your destination. That's what we're able to do with cognitive coaching. There's a great book called The Brain That Changes Itself. And it talks about this idea of neuroplasticity. That, for a long time, we were told, or the research said that, okay, you've got a 2-year window to really help improve that cognitive functioning. But what we've seen through cognitive coaching and cognitive remediation is that we can make those improvements. And some of these previous, prior NFL players, they are able to benefit from those as well.
All righty. Alba asks, what does it look like to do shadowing or pre-career exploration for neuropsychology?
So I think that this happens a lot, especially I know NYU does this, and our students are called hiccups, and it's health career occupational students. And so they come, they apply every summer to work at Rusk or NYU for a span of time. So in neuropsychology, what that would mean is that they come into our clinic, they can sit in, we have them, we have them sign paperwork for HIPAA to protect the identity of our patients or clients, but they can sit in actual sessions with us. They can observe groups that we may offer. They can, sometimes they're doing some research for us. So big institutions like NYU, I'm sure DuPont has a volunteer program as well, but, I know that sometimes it can be competitive. So thinking about getting that application done now, I think is a really good idea if you're thinking about the summer. But oftentimes it does include doing all the things we would typically do. And you come in, a couple days a week. And so I've been in touch with students from the previous years, and I think them having those experiences was helpful. I always like hearing later that they went on to graduate school or they went on and did something related to the field because they were able to be able to observe us.
Right. So August asked, how do you improve from mistakes and make that error turn into a lesson?
Ooh. Hang in there. Stay the course.
Yeah.
Don't give up. And if you're feeling like you don't have, as with all of us, including myself and Dr. Connor, we don't always have the answers, and we always seek out support from people who might have helpful answers to us. So for instance, other neuropsychologists, parents, pastors, anyone that you think may be able to provide helpful information, a medical doctor. Just stay the course and ask lots of questions to a number of people.
And then
Right.
also read. And I don't know if you're, whoever asked the question, if you're a big reader, and I'm always, my students are always like, oh, Dr. Connor, you're always throwing a book at us. And I was like, I can't help it. But there's a book by Carol Dweck entitled Mindset. I think when you can either look at a mistake as a failure and not grow from it, or you can decide that you're going to learn from it. And so sometimes that means, like Dr. Brown is saying, like getting someone else to remind you that, and there are great quotes out there that a lot of times people get to their goal because they made more mistakes. They made lots of mistakes until they got to, whatever the result was. And so, never quitting and having a different perspective on a failure. Failures are often really powerful. And it's those that help us learn the best. So.
Right. And I would personally add along with that leaning into the discomfort
Yes.
of what is negative to find the positive. Sometimes the best way to get through a storm is to go straight through it rather than to try and go around it. And discomfort comes in many places in our lives. So you may as well learn how to lean into it.
Yes, very true.
Right. Lamia, this is a very interesting question. In school, how would you study, and in which way would you advise other people to study?
I love that question. And Dr. Brown may have some comments as well. I would think when it comes to studying, one, determining how you learn best. Are you someone that, is a visual learner? Are you someone that's more of an auditory learner, or both? So, you know, a lot of times the way that you learn information is also a good way to help you recall the information. I guess they call it state trait learning. So if I'm in the same state that to learn the information and I'm in that same state to recall it, a lot of times you're able to recall that information. You know, one of the things
And
that
by
was
state, you mean emotions, location.
Yep, absolutely. Thank you for clarifying or adding to that. But I think the other thing I would say is, you know, learning from past, you know, your past experiences. When did you find yourself encoding or taking in information more? Was it working individually or was it working in a group setting? In graduate school, there were a lot of competency evaluations that we had to take. And so I found the students that actually wanted to, like, you know, pass the test, and I studied with them. And so that really helped me out as well, you know, identifying somebody who had a very similar learning style and then studying within a group. There's great resources out there for flashcards, depending on whatever topic you're looking at that I think are helpful. But then there's also great resources for just memory strategies, because that's part of studying, right? And it's something that we talk a lot about is how do you take in new information? What kind of strategies can you use, whether it's visual cueing, you know, maybe you see something and it reminds you of something else, or maybe it's taking lots of notes, having organized notes as well. So a lot of times you might want to combine, you know, the external strategy, which is taking notes, with an internal strategy, like coming up with an acronym for something you need to learn. So.
All righty. What advice would you give about juggling work, life, school, life balance with home life? All that.
Whew. Dr. Brown?
Oh. So I will say it's always a work in progress for anyone who's trying to juggle that many things that are important to them in their life. But I always recommend meditation. Meditation 1 to 3 times per day for 5 to 10 minutes, where you can kind of slow down the thoughts that are going at such a rapid pace, but also check in with yourself, your body, your thoughts, your feelings, and what you need in that moment. Sometimes you may need to make a shift, and that can be really important and helpful. So, and then also check in with people that love you and see if they feel that you're having a difficult time or if you're doing everything a-okay. I think those are some things that are really important for juggling.
If I might add, sometimes doing an inventory of what you're grateful for
Oh, goodness.
Yes,
can
very agreed.
provide fantastic perspective, especially when things feel like they're all going against you. Stop and go, what? Maybe.
Yes.
Ooh, Amber, good question. What was one of the most difficult things for you in your schooling?
Oh my goodness. Dr. Brown, I know this one like at the top. So I'm gonna go for this one. It was, for me, there's an exam that you have to take to be licensed called the EPPP. And every psychologist has to take this licensing exam. It's 225 questions. And I'm married to a medical doctor, right? And medical doctors just know how to take tests. I don't even understand it. They know how to take tests and even things that they don't even know. I struggled so much with that, you know, being able to take this exam. And I actually took this exam multiple times before becoming a psychologist. And so I think part of it was that when I didn't pass it the first time, I really felt defeated. And I felt like, oh my gosh, I'm never going to be a psychologist. And so it actually ended up being a big part of my story and why I do a lot of mentoring in passing this very important exam. I didn't know at the time what that meant, but I'm a spiritual person. And I tell you, like, you know, doing a lot of praying and also seeing a therapist to even like understand like why I was so, you know, why anxiety was like getting in the way of me passing this big test. So I did finally pass it, thank God. But that was one of my biggest challenges.
Yeah, and I say for myself, dissertation, I kept having dissertation chairs retire or move to another school. And the advice that I eventually received and I took to heart, and it worked out extremely well because I was able to finish my dissertation. And about 8 to 9 months, was find the dissertation chair that is most known for helping people finish their dissertation within a year, especially if you have to collect your own data, which was the case for me. I couldn't use data from someone else's research. So.
And the dissertation's that big paper that you have to complete to graduate from graduate school.
Yes,
So.
it's a book. It's the size of a book.
Right. Not, I might add in here from my own undergrad experience, know yourself and know your limitations, in particular as they relate to when your classes are scheduled. I found myself one semester, it was foolish. I was on a pre-med track, but I had a couple of electives, and I decided to do astronomy and ornithology
My
in the
goodness.
same semester. Now, think about that for a minute. I'm up at 2 o'clock in the morning looking at stars, and then I have to be up at 4:30 in the morning counting birds. It was a catastrophe. So be aware of what you're setting yourself up for in your course selection. Choose wisely.
Great advice.
There's we're gonna do one last question. So Alba, I'm going to get in touch with you and answer your question in detail. So I will catch up with you. Where would you recommend doing an internship for a high school freshman?
So a high school freshman. So an internship usually would be at the end of your graduate school. If you're looking at neuropsychology, okay, I'm a little biased because I work at NYU too, so just keep that in mind. But I would say there are fantastic programs. Children's Hospital of Philadelphia come to mind in terms of a really good internship program. AI DuPont has one as well. There are quite a bit in the New York area where I am. There are, and it would depend if you're looking at a hospital setting, which is going to offer a variety of different opportunities. In our area, that's something that comes to mind, but also places like Boston Children's Hospital, or, even, there is, there's Child Mind Institute in New York. Man, there are so many different ones that I would say could be fantastic. The APPIC.org has a whole directory of every single internship program. So that's one of the places I would recommend you start, is take inventory of all of the different programs that you're looking at. If it's psychology or neuropsychology, you're going to look specifically at those kind of programs, and you can do a specific search for that. But you also want to think about an internship that is accredited by the American Psychological Association if you're looking into the realm of psychology. Sometimes if it's not accredited, there could be some more obstacles in your future. So I would think about that as well. And then also think about geographically, where do you want to be? Internship is 1 year, fellowship is 2. So oftentimes interns will go all over the country. I got to tell you, I really wanted to do an internship in Hawaii just so I could go to Hawaii. That didn't work out. So think about that too.
Right. And the other thing too, so we're responding to the questions of internship based on our own sort of educational knowledge of what it means in our world. If you're a high school student, what you're probably asking is what kind of extracurricular activities,
like a practice,
so this experience you're having right now with many medical schools is a great extracurricular activity. If you go ahead and go through our process, do the ropes, become a member of the Delaware Youth Medical Academy, that's a sign of your getting exposed to more and more types of healthcare and dentistry and public health discipline, different types of practitioners, physicians, nurses, therapists, researchers and so on. So that's the kind of thing in you, especially for high school students. You want to do those things which are going to set you apart, make you unique amongst all of your peers who may be academically as gifted as you are. Find that thing that makes you unique. Doctors, thank you very much for the time you spent with us this evening. It was great. And we will see you all next week. We're going to be talking about dentistry next week. Have a good evening. Bye-bye.
Good luck, everyone.